Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair loss, or insulin resistance, you might be dealing with PCOS, or Polycystic Ovarian Syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created Ovii. Ovii is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. Ovii offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to ovii.com. That's ovii.com and start today.
Okay, so this episode of She&D is gonna go down as, I'm sure, my favorite, because all we're gonna do is laugh. I met this incredible woman, Leanne Morgan, across from me with Reese Witherspoon, who during COVID started sending me these clips from social media. And she just said, if you feel a little sad and you need somebody to make you laugh, and I was like, who is this woman? And I think at the time you had done a podcast with your nurse practitioner who helped you with menopause. What was that podcast called?
Sweaty and Pissed, Menopause and More.
Can you kind of go back and tell us how you turned menopause into a second chance in life career?
All right. So I've done stand-up for over 25 years, raised 3 babies in Knoxville, Tennessee. And, career was all right, not great, but I was able to raise my children. And then I'd say in my mid-40s, my health, all of a sudden, and I know it was perimenopause now, but all of a sudden, I just couldn't put one foot in front of the other. I was so fatigued, cried a lot, didn't know why. Also, I was having children leave to go to college, and I would take to the bed over that because I love my children, and I wanted them to go to college, but it would hurt. All this was happening at the same time, and I didn't know what in the world it was. And I went to my precious doctor for a sinus infection. He was really good at that. But I said, my hair's falling out. I don't feel good. I'm tired all the time. He goes, I think you're depressed. I go, I think I am depressed because my hair's falling out and I can't poop and I don't feel good.
Weight.
Yeah, I'm gaining weight and I don't feel good.
Not
and I kept saying to him, I think something's wrong with my thyroid. I've got all those symptoms. He goes, no, I've done a panel. You're fine. Turns out that was an antiquated panel. So anyway, I felt hopeless. I thought, what in the world's happening to me? My husband thought I was going crazy. I felt like I was going crazy. That woman at the front desk said, I've heard of this nurse practitioner who is changing people's lives. She had 4,000 patients. Nobody was going to those male doctors that she worked under. Everybody wanted to go to her. So I go to Karen Nichol is her name. She's now retired. Okay, so I said to her, she fixed me. She goes, I'm going to check your thyroid. I go, it's fine. He said, it's fine. She goes, I think that's an antiquated panel. She said, your thyroid has crashed. I'm going to try to get it back up with supplements, but if I can, I'm going to have to put you on thyroid medicine. She said, I think you've got a gluten thing. She tested me for that. I did. She said, I think you're estrogen dominant. It took a while, and she got me to where I felt better. And I said, I'm a comedian. And I said, my career's in the toilet. Maybe we could do a podcast and that would help me, but also it would help other women because nobody knows what to do about their hormones. Because all my friends didn't have anybody to go to. Nobody knew what to do. And my sister was living in Nashville, and her doctor said, your mama had to go through it. You're going to have to go through it. There's nothing I can do for you. It'll cause breast cancer to go on hormones, all that kind of, that whole thing we all know now is wrong. So anyway, we started doing this podcast together, and then my career
went through the
in my in my early 50s, overnight, my social media people put out a clip that went viral. It was me talking about old people going to concerts and how everybody had plantar fasciitis. And I think the lead singer of Def Leppard had a hernia. And I started selling out all over the United States. And this podcast got bigger and bigger and bigger. And it got to the point where I had to stop doing the podcast. She does it by herself now because I was so busy. But anyway, that's how all this happened. And then I got a Netflix special. Went on my first tour, the Big Panty Tour, Dr. A. And I talked about my big panties because I do love a big panty after I've been through perimenopause. And I talked about on Netflix perimenopause and how, my husband was like, is that steam coming off of her in the bed? And I have had people say to me, you're the first person to ever talk about perimenopause or menopause on Netflix.
And it was huge. It was the special.
I'm so proud of
was
you.
Thank
huge.
you.
It literally is the funniest thing I've ever seen.
Thank you, my darling. That special did really well. And I'm going to do 2 more specials with Netflix. And they gave me a sitcom. And that was my dream when I got started in comedy, because I'm 59 years old. I grew up watching sitcoms. And that was the thing, to be Jerry Seinfeld, Ray Romano, Roseanne, everybody. So this is a big deal to me. And, I did do a movie with Reese Witherspoon. That was something that came out of heaven, dropped in my lap. That little doll, she did that for me, that angel. And I play her big sister, Gwyneth.
I know.
And you're cordially invited. But we talked about magnesium on set. We would say it, and, she's so tiny, and I wanted to hold her like a baby. But we, women get together and talk about, are you taking enough magnesium? Are you having your bowel movements okay? Are you on hormones? Are you on hormone replacement therapy? What are you doing for your this, that? It brings people together like when you had your babies. I think when you're having your babies, you talk about, I had a C-section and, all that. It's now, menopause is that for me now.
It's because men don't give birth. Men don't go through menopause. Anything they're not involved, nobody talks about. But that's changing. You're talking about menopause. And as you're talking, I'm like, menopause was in a way the worst and the best thing that happened to you, right? Silver lining.
Yes.
It made you who you are. It opened up all these doors. You turned something negative into something so positive, which is amazing. And bringing awareness to it. So women all of our symptoms always get dismissed. So I appreciate what you're doing, and I can't wait to watch all those episodes on menopause.
No, it's hilarious. They're amazing.
Thank you. Well, I've always been an open book.
Yeah, you have.
And I've got a sister who is very private, and she's like, you talk about anything. But I think that's just the comedian. And, and that's what I've gone through. I've raised 3 children. I've been married for over 33 years. I've had 3 babies, 1 C-section, 2 vaginal VBACs.
Let me say what VBAC is for our listeners. It's vaginal birth after a C-section. So once you have a C-section, you can have vaginal birth, and we call it VBAC. Okay. Just in case.
But anyway, I just have always loved my girlfriends and loved to talk about stuff. I'm very open about that kind of thing. But I got my degree in child and family studies, crisis intervention counseling. So I've always loved child and family therapy. I wanted to be a therapist if I wasn't going to be a comedian, but I like talking about things. I think it's
healing.
It's healing. And then if you can laugh about it too.
Yeah.
But I just remember perimenopause was a horrible time. Mm-hmm. And I thought something was really bad wrong with me. And I've tried to tell my sister and then her friends, because they're in Nashville with these OBGYNs that are the best in Nashville with men, that have told them, no, you can't do anything about that.
No, but guys, I'm not kidding. So again, I'm going to say this, and I hope you guys are listening to this, because my sister, who's a nurse practitioner, was telling, there was a group of 6 women this week in Tennessee who are in perimenopause, and they all went to their doctor saying the same thing. And the doctor said, you're not in menopause yet. You don't need hormones yet. You've got a couple of years yet. And Michelle, my sister, said to them, how much suffering do you need to have? I mean, they're having terrible symptoms, and again, these women that we were talking to have the ability to go to the best doctors, and they're still being told this, antiquated information.
And actually, a lot of the bad symptoms start in premenopause, but because women are having their periods, they don't associate the symptoms to menopause. So they come up with a million excuses. I had a patient this week. She's like, I don't feel good. She's 44. She's like, I have brain fog. I'm very depressed. I'm anxious. I'm not being myself. She didn't even think of premenopause until I brought it up. So this is so common. And because people don't talk about it, women think they're going crazy. Her husband told her that she was having dementia, that she should get checked for Alzheimer's because she would forget. She would not be there. And she came to me and she wanted to go see a neurologist to check her for dementia. I'm like, this is not dementia. This is brain fog that comes from perimenopause, premenopause, but nobody talks. It's really sad, you guys. What I see in my office, I keep saying it.
I know you do.
What happens to women is really, really sad. And I practice in Beverly Hills. Imagine what's happening to other women around the world.
Out in the middle of the United States. Because you're right. I remember saying to my nurse practitioner, to Karen Nickel, I said, could I have early onset dementia? She went, no, Leanne, it's perimenopause. And, but I remember like having heart palpitations and thinking something's wrong with my heart.
Yeah.
And then I got to thinking, am I a hypochondriac? Like there's something's wrong all the time.
Did you feel better right away?
It took a while, but I started feeling better. Like my hair stopped falling out. When she got my thyroid tended to, I felt like I had more energy. She also said, Leanne, you've got that. She said, let me check you for that gene mutation, MTHFR. And I have that.
What is that? Tell
Well,
us what that is.
40% of the population is positive. It's a gene mutation. You know, we used to test it for pregnancy, but that alone does not, MTHFR is not explaining all the symptoms.
But she said you're not getting your B vitamins. You're not absorbing them.
Yeah, but that still by itself doesn't cause all those symptoms. And I don't want people to get confused. Average age of menopause is 51 and a half. And 7 to 10 years before menopause, women go through premenopause. So if you're 43 and you're not feeling well, it could be premenopause. What happens, because it starts slow and different women have different symptoms, people get confused, right? One person might just start getting moody. Another one can have hot flashes. Another one has hair loss and weight gain. People have different symptoms with it. You do not need to have irregular periods or miss your periods to be diagnosed with
hot flashes. Because I never got hot flashes, but I wanted to kill somebody 24 hours a day. So I was like, oh my God. And I forgot, where my keys would end up in the fridge. I mean, it's just one of those things where before I met this woman next to me, I thought you have to have hot flashes to be in perimenopause. And I thought, oh, well, I'm too young. All those things.
All those things. And I think what bothers women the most is the brain fog. It's a huge change. I mean, hot flashes, night sweats, people talk about, weight gain, people talk about vaginal dryness. At least now we're talking more about it, but the brain fog, no one talks about. The anger, the emotions, wanting to kill your partner at home, having relationship issues, having problems with your children, all of us. And we all go through different versions of menopause and there are different treatments for it. Not everyone will benefit from hormones, but if you're 44 and you just don't feel well, you're not sleeping, you feel like you have brain fog, your mood is bad, you're gaining weight, you have vaginal dryness, there's no reason not to have someone like that patient on hormone replacement early, way before menopause hits. So an average age of menopause is 51 and a half, but from 45 to 55, people can go through it. You can have a 53-year-old who's still menstruating and you have a 46-year-old who doesn't have a period anymore. So it's a range, right? The average being 51 and a half. So it's important for women to talk about it, to know that we can treat them. Of course, someone like me with history of breast cancer might not be able to take hormone replacement when I'm actually taking an anti-estrogen. But there are other medications besides hormones that we can use for women like me to help their symptoms. So there are options.
Well, and I wrote a book and it's on the New York bestsellers. Times bestsellers. They told me that and I thought, what in the world? And I named it that. What in the world? And it's a guide to Southern. Okay, do it for me because I'm sitting here thinking
It's the
I wanna get on
menopause brain. Okay,
semaglutide.
here we go. What in the world? A Southern Woman's Guide to Laughing at Life's Unexpected Curveballs and Beautiful Blessings. Isn't that's such a good title.
And so thankful that title. Thank you for reading that because, life kicks you in the teeth and you got to find the good out of it. And me being a comedian, I've made jokes out of everything all of my life. My husband's very serious and he'll say, you don't take anything serious. And I don't. But that's how I've coped. I think that's what comedians do is we cope with bad times through humor. But yeah, that book is number one on Audible because I read it. And people like to hear my voice, which I can't even imagine because I can't imagine this is soothing. I hope people laugh and I hope there's a little bit you could cry in there. I talk about ups and downs like we all go through and things that hurt and, but how you get through them. And, in that book, I talk about how I had a falling out with my best friend. When you said problems with the relationships, also in friend groups.
No.
I've had more people say that to me, that people get weird.
Yeah.
And I had that happen to me. And I thought about taking it out of the book. And then people said to me, no, Leanne, that's so relatable. People have gone through that. But I look back on it and I was going through this terrible time where I felt so bad physically, mentally. And then she probably did too.
Mm-hmm.
Maybe you should call her. Now that you know.
We talk back and forth a little bit. Yeah, it's okay. But it'll never be the same, but it's okay.
You know what I always tell my patients who come with premenopause or menopausal symptoms? I'm like, bring your partner. Bring your partner. Let him come sit in this room and listen to me because these symptoms are real. Just like I talk about postpartum blues, postpartum depression with my patients' partners. You have to understand when your wife pushes a baby out and we pull that placenta out and the hormones shift drastically, that her body will take time to go through that change. Be patient. I always tell when husbands tell me, what can I do? I say, for everything we do for you guys, from getting pregnant, risking our life, gaining weight, getting stretch marks, pushing your baby out of our, vaginas, getting a C-section, breastfeeding, losing hair, getting moody, all of that. The only thing you have to do or men can do for us is to support us, not to argue, be there for us. Don't judge us. Don't call us crazy. Just be there. That's the only job. For everything we're bringing to the table, that's all you have to do in return.
And I also think I think about your story, which is so incredible. You were raising these babies, you were a comedian, but a lot of us still want to have a career and do it. And it's hard. Like, how did you deal with raising these children? Or was it that they were a little bit older when the second career started?
But I had started before that, dabbling. Mm-hmm. But I was in the foothills of the Appalachian Mountains selling jewelry. I started selling this jewelry in women's houses instead of using my degree. And I didn't mind one bit because I needed to meet friends. I felt very isolated when you have a baby. I was up there in the middle of nowhere and I never lived anywhere that rural. I'm rural, farming people, but not that rural.
That's rural.
I look back on it and how perfect it was because I was in these living rooms with these women and I was supposed to be talking about jewelry and I was talking about hemorrhoids and breastfeeding and Chuck didn't hear the baby in the night and I was angry and women thought it was funny and started booking me about a year in advance. And that gave me the confidence to try to make it in comedy. Cause I'd always, from the time I was 9 or 10, I thought I'm going to Hollywood. I don't know what I'm going to do, but I'm going. So then, Chuck Morgan, my husband, is a very type A, very, driven, is a president of a division of the company he works for, has always worked and achieved. And I knew that about him and I wanted to have babies. So I always supported his career. He's always supported mine, but he traveled and had a big job. And so I was the one that was taking care of these babies. To do comedy back then, you need to be in a comedy club from Wednesday to Saturday night or Sunday, fly home. And I could not raise my own children if I had done that. Yeah. And people would say to me in the industry, you can't do this with a bunch of babies, Leanne. And it would make me so mad, but they were right. It would have been very difficult. I wouldn't have raised my own children. And I did not want that. So I just had to carve out another path. So I did a lot of private corporate things. I did a lot of women's breast cancer events, ovarian. They would hire me to do it. I loved doing it. It would get me on stage. So I didn't have a normal path coming up through. But I would do so many comedy clubs a year when Chuck could be at home with them. But I just had to find another way, but always in my heart, I knew I had to keep going and that I was supposed to be doing this. And I felt alive when I was on stage. You know, when they were babies, I would be talking about birthing and breastfeeding and hemorrhoids. And then I went through where I'd talk about T-ball and me going to Weight Watchers and, you know, and low rising breeches and how my stomach hung over my pants and looked like a small purse. But I would be talking about whatever I was going through. But I had enough success that I thought, I've got to keep going, but it wasn't going great. I mean, Comedy Central was not into me. You know, I was a mama with a kitten heel on and a capri pant talking about breastfeeding. That wasn't on Comedy Central.
That was not.
I just kept my head down thinking, I've got to do it. I know I'm supposed to do it. And these babies gave me so much material. My husband gave me so much material and everybody was fine with it. And, but it was hard. I don't know how women work all the time and do what y'all have done. I had it easier, I think, because I could go to a club at night and get on stage, or I could go and do a fundraiser, come back the next day. I wasn't working all day long. I was able to wash clothes, get all that done, cook and do, and then, and iron their little uniforms and pick them up at school and drop them off most of the time.
Yeah.
And if I was out on the weekends working, Chuck could be with them. And then I really and truly thought, I'm about to quit. It's not going anywhere. And I just felt like I was working all the time, but it wasn't the kind of work I wanted. And I knew in my heart it was not the success I wanted. And the only time I've ever felt that way. And I went out to dinner with Chuck and I cried and I said, it's not going anywhere. And I'm here in my early 50s, and what am I doing? And now I'm 59 years old, and I think I'm one of the few comedians that have a show.
It's crazy.
Netflix. I'm learning this whole new skill set and all this, but at 59 years old, and I don't mean to be sappy, but you would not believe the people, because I tour. I'm on tour, and I do 100 dates, but I've toured all over the United States. And this second tour is called the Just Getting Started Tour, because I feel like I'm just getting started at 59 years old.
That's awesome.
But
well, you don't look 59.
Thank you. Well, I didn't have sun damage like most people because I had a melanoma at 21. And it scared me so bad that I don't have.
Have you done your genetic testing?
She's going to make you do your genetic testing.
Oh, I want to do my genetics. I love a good test.
Melanoma. So there's a test. Actually, it's called Malaris, which checks you for gene mutations associated with melanoma. But you can take them. You can take any genetic test, because a lot of gene mutations associated with melanoma can also cause other cancers like breast cancer. For example, the BRCA gene mutation is associated with melanoma.
BRCA? Is that the BRCA one?
Mm-hmm. So it's not just BRCA. There are other cancer genes too, but I'm just using BRCA as an example. And I saw that your daughter had thyroid cancer.
My baby child.
Yes. So I think you need to do the genetic test just to be safe.
So I've got Charlie, Maggie, and then Tess. Y'all have met the baby. And she got on the Ovii questionnaire, and we think she has PCOS.
Yeah. And
she took the test?
Yes.
I'm so proud of you.
And I ordered it, the supplement. I said, you better drink it.
What are her symptoms? Tell us what her symptoms are.
She has had some insulin resistance.
Does she have acne or hair loss?
She has had
facial hair, body
She
hair.
has had facial hair, yes, and has had it on her arms and has had it, likes to get that for Christmas removed. She's very bougie.
And she found out she had thyroid cancer at 21.
She had thyroid cancer. It was Karen Nickel, who was my nurse practitioner, was tending to all of us, felt it and said, I think you need an ultrasound. Went, because her numbers were okay. Went and got the ultrasound and they found it. And she had that all removed. She had radiation and twice. And, but she would have ovarian pain when she was little. And I don't know that she ever had a cyst burst, but it always made me wonder if it was PCOS. And I've got friends that have got PCOS, but yes, that's my baby child who is my professional makeup artist. She went to school for makeup for television and film, and she keeps me alive. She's out here and she has to drive me at night because I can't see. And we're very close. She is, how old are you, baby? I just lost my train of thought. She's 26.
26. Oh, come on in.
Oh my goodness.
Will you pull up her chair? Will you have her pull up
Can
a
we
chair?
give her a mic?
Can we give her a mic and have her talk to us?
so
We'd love to
good.
have you here, you gorgeous thing.
Look at, they've got tiny fannies and they can sit together in those chairs.
That's perfect.
So we had to bring Tess in because we were talking about PCOS and we didn't want to talk about you behind your back. You were sitting in the other room.
Yes.
So first of all, you're gorgeous. This hair
Thank
that you said
you.
you just had sewn in.
Sewn in.
It's so natural, whoever did it.
Thank you.
But is it because you have a lot of hair loss?
Yeah, I used to have this much hair naturally. And then I had the thyroid cancer and then I had radiation and all that. And it just kind of never really came back.
And you were diagnosed at what age for PCOS?
I had it for the first time at 21. And then,
Oh, you mean the thyroid cancer, baby?
yeah, at 21. And then I had a little stint come back at 23 and then I was fine.
And then what about PCOS? When did you get diagnosed?
That
Well, your mom
16?
Oh,
16 or 17 maybe?
When you went to Children's Hospital and you had that ultrasound,
Yeah, so I was probably
They
freshman in
said-
high school. So maybe like 15, I think is when that all went down.
And so your mom's you've just done the Ovii assessment. You're on Ovii, but what are your other symptoms? You've got the expert in the world here sitting.
I don't know if I love how she says I'm the expert in the world. I'm not. I'm Dr. Aliabadi and I practice out of my office.
you are a beauty. And do you want to live with them? Can we all live with them, these two?
I know. I want to look like that in a jumpsuit.
I
will
know.
Make you, hello, I will make you look like this in a
Okay.
jumpsuit. I need 2 years.
Perfect. I can give you 2 years.
Let's do it. Tell me your symptoms.
Okay. I have never had a regular period
Okay.
ever.
Okay.
I don't know. And I haven't had a period probably in 4 or 5 months
Okay.
right now. I do have the facial hair here.
Okay.
I do have it on my arms. I didn't have that lasered off.
Hair loss.
Hair, and then the hair loss on my head. Yes. I've never had the acne.
You don't have to have acne.
Yeah, I don't have that symptom. Insulin resistance, and I gain weight really fast, but I can lose it really fast. But so like my body's just all over the place.
Mood disorder, anxious.
Sometimes you're hateful.
That's usually from you, respectfully. My mood does go.
I was going to say
I've had some mood.
PCOS patients are
things.
moody people.
We're moody people.
Really?
Not always.
Oh, that's
Not
good to
always,
know.
but it's common for them to have
Yeah.
mood disorder. So I have a question. You were diagnosed at 16. What did they do for you?
Got on metformin,
Okay.
That
What
was all.
dose? 500?
500 maybe.
Once a day?
I think so.
Yeah, that's not going to work. Okay, go ahead.
So I did that. I can't even remember how long I was on that because I got off of it at some point, and I don't remember honestly
Okay.
why.
They put you on a
And then-
synthetic birth control pill,
I've been on a synthetic birth control pill.
For how
which
long?
has worried me. And what do I know? But I just
No,
didn't know
long-term
long as
birth
she's been
control
on it.
use is worrisome.
I got on that after the thyroid.
Do you get periods on it before this 5, or you completely skip your
I just
periods?
completely skipped my periods.
Okay. And when you get your periods, are they painful?
Mm-mm.
Okay, good.
They're not painful.
So you
they're
don't
not
have any-
long. They're like 3 days max, and they're not much.
Any
Okay.
history of eating disorder or disordered eating?
Not really. I eat my feelings. I'm one of those people, but
Yeah.
I wouldn't say like
Okay.
disorder necessarily. No.
Good. And what, besides birth control, what are you on now?
Now I'm on Synthroid for the
Thyroid.
thyroid. I take vitamin D, B complex, berberine.
Mm-hmm. And your mom said you ordered the Ovii
And I ordered the Ovii.
powder.
Yes.
Okay, good. Excellent. You know, you have all the symptoms of PCOS,
Mhm.
pretty much. I'm sure you know that. To diagnose PCOS, you need 2 out of 3 criteria. One is irregular period.
Mhm.
You have 2 is PCOS looking ovaries on ultrasound, which your mom said you had an ultrasound and they told you have a string of pearl. So that's number 2. So based on those 2, you're diagnosed. And number 3 is elevated testosterone symptoms. So it could be, most common is facial hair, body hair. You could have hair loss, acne, body acne, facial acne. So we know you have 3 out of 3. So there's no question about the diagnosis. PCOS patients usually have mood disorder. It's hard to say if mood disorder is part of PCOS or because of the weight gain and the acne and the hair loss and, they get frustrated and, it eventually affects their self-esteem and their mood and all of that. So it's hard to differentiate that for patients, but they usually have family history of an overweight family member or, someone who's diabetic or pre-diabetic. And they tend to gain weight as they get older and it's harder for them to lose it. And, generally speaking, they have a lot of eggs on blood tests, but the quality of it goes down after 30. So I would tell you, if you were my patient and you can afford it by 30, I would have you freeze eggs, even though you're going to have tons of it. Have you done an egg count? So that would be something
But
you should do.
we've been talking about her eggs. And she said the other day, wonder if I should freeze them.
How old are you?
26.
So it's a little too early. I mean, you can freeze eggs at any age, but it all depends on your egg count, right? Because so many factors affect your egg count. PCOS patients, generally speaking, they will get a higher number of AMH in their blood count, the anti-Mullerian hormone that gets released from the follicles, but the quality of it goes down after 30. So because of that, unless you're ready to have a baby, I would say freeze eggs maybe by 28, but you need to check your hormones. You need to check your egg count. Even though we don't need high testosterone in the blood to get the diagnosis, you still need to know what your egg count is and what your hormones are. You want to make sure your thyroid is leveled, your medication is good enough, your prolactin is normal, your testosterone free total is normal, your DHEAS, which is a different type of androgen, that's normal. So it's good to have these blood tests. And metformin affects your vitamin B12. So I'm glad you're on a B12 supplement. We'll talk about insulin resistance. And, you were talking about your belly. It's probably the same DNA, right? As we go through menopause, we become more and more insulin resistant. And that's why during menopause, when we're younger, when we gain weight, it's everywhere. As we go through menopause, we start gaining it right here in the midsection. And, so that's insulin resistance, right? And it's the same underlying condition that's causing her PCOS symptom. And so it's good
you
to
could take Ovii too, just so you know. It would help.
It would help because
that
it helps with insulin resistance.
Because I feel like when all of a sudden I feel like I built like the people from Whoville. Like the stomach, my legs might be getting smaller, and then the stomach, I've gone up a size in my pants.
Let me tell you what I would do for someone like her. Okay, just, obviously we treat different patients differently. We treat your symptoms. I absolutely do not want you to have hair extensions. We can help that. But again, you have to fix the underlying condition. So when we talk about PCOS, there's the insulin resistant part and there's the PCOS symptom part. The insulin resistance means your body does not process sugar well. When we eat carbohydrates, our body breaks it down into glucose. Glucose stimulates our pancreas to release a hormone called insulin. The job of insulin is, in a simple term, it goes to the surface of the cells, opens up and wakes up the receptors on the cells. The receptors grab the sugar, put it in the cell where it turns into energy. This is what's supposed to happen. But PCOS patients have insulin resistance. So when you eat carbohydrates, your body breaks it down into glucose. Your body releases insulin. The problem is your cells are insulin resistant. They're not responding to the insulin. The receptors don't open up to grab the sugar. So sugar can't go in. It bounces in the blood. As your sugar goes up, your insulin starts going up. Insulin is a fat storage hormone. When it goes up, it does 2 things to the body. Number 1, it tells your body, take that sugar and store it as fat, so your weight goes up. But it also stimulates your ovaries to release more testosterone. So on one hand, the high insulin is causing you to gain weight, but it also stimulates secretion of androgens from your ovaries. And it's because of that your periods get irregular. You start losing hair, you have facial hair, body hair, acne. Different people have different symptoms. Now, when you go to your gynecologist, or most women do, and they complain of acne, hair loss, facial hair, body hair, irregular period, they write for a prescription for birth control pill. Birth control pill doesn't work up here for the insulin resistance. Generally speaking, and this might get too medical, but PCOS patients have a low level of sex hormone binding globulin. It's a protein in the blood that grabs onto the free testosterone in your blood, because it's the testosterone that causes all these symptoms. Well, PCOS patients have low levels of this protein. Birth control pills stimulate the sex hormone binding globulin. So it starts grabbing the testosterone out of your blood. That's why your acne gets better, your facial hair your hair loss gets better, your periods can become more regular. That's how birth control works. So birth control down here is masking the symptoms of PCOS. Do you understand?
But not fixing it.
But not
fixing it.
That's why when people take birth control, they're like, well, I gained weight. It's not really the birth control. It's the insulin resistance that's causing all this. So now that you've dealt with the PCOS symptoms down here, you still have to deal with that insulin resistance. Metformin, the reason some doctor gave it to you at 16, metformin makes you insulin sensitive. So it makes your body respond to the insulin that's being secreted. So these receptors are opening to push that sugar in. The dose of 500 milligram once a day is not going to do that for you, right? So you were underdosed. So metformin works up here by making you insulin sensitive. As patients become more insulin sensitive and we clear the sugar out of your blood, your insulin levels calm down so you don't gain as much weight. As insulin calms down, your testosterone levels that are secreted from the ovaries go down, your periods become more regular, and your symptoms resolve. So metformin works well. What we did with Ovii is our supplement Ovii deals with all symptoms of PCOS. It regulates your hormones. It regulates your blood sugar. It's very anti-inflammatory. PCOS patients have a chronic inflammation. So it's very anti-inflammatory. It has a lot of antioxidants in it, and it helps with that insulin sensitivity. So overall, it'll help your symptoms. You can also add metformin to it in your case. But one thing I would do with you for sure, and I started doing this in 2014 with my PCOS patients. Someone like you, I would start them on GLP-1s, these injectables. I would have you drop your weight. I would give you metformin. I would have you do Ovii. And I would have you continue your birth control pill. I would have you check your hormones. I would check your egg count, depending on your egg count. If it's normal by 28 to 30, if you were my daughter, I would freeze your eggs. And the problem is egg freezing is expensive and a lot of people can't afford it. If you can't afford it, at least listening to me and suppressing the symptoms will help. But as long as people understand that the quality goes down, a lot of PCOS patients go to their gynecologist at age 35, 36, 37. The gynecologist does an ultrasound and says, oh my God, you have so many eggs. Don't worry about it. You're good. You're good. Come back in a few years. It's not true. It's the quality that we worry about. For you specifically, you don't really have acne, so we're not going to talk about acne. The hair loss bothers me, right? Since you're on birth control, I would also put you on a medication called minoxidil. Have you guys heard of Rogaine on the scalp? So this is a pill form of it. I compound it with a pharmacy that I work with. And it helps with hair. The problem with hair is it takes a longer time to recover from hair loss. But at your age, I don't want any hair loss. So your thyroid needs to be optimum. Your PCOS symptoms need to be resolved. And we know how to do that. But not every PCOS patient needs this regimen that I told you. But for you, I would do GLP-1. I would do metformin. I would do the Ovii powder. I would do the birth control pill. And I would freeze your eggs. And I would do the minoxidil for your hair.
And you don't have to do all this forever.
Right.
But this is just what she's saying. And every patient is different.
And one thing I want you guys to understand, and that's why I get so frustrated when people say, wait, I did, I don't know, Mounjaro or Zepbound and I lost all my weight and I stopped it and I gained it back. Why? Because you stopped it. And the insulin resistant, the problem is still there. You can't delete insulin resistance. But if you drop your weight and you address that insulin resistance by staying on the metformin, doing the Ovii supplement, we will be able to maintain it. Now, obesity has multiple factors. It could be that you get stressed out and you eat. It could have an emotional issue with it. So, but we need to deal with all of it. Are you anxious? I'm going to fix it. Are you depressed? We need to address that. Do you have an eating disorder? We can address that. And I always say patients with disordered eating or eating disorder, they do that out of frustration. And once we fix your symptoms, drop your weight and teach you how to maintain it with good diet, exercise. Another thing I would tell you, after, we learned that insulin resistance, your body can't tolerate or process sugar well. So you have to cut down sugar. That should be your religion. Do you know what I'm saying? You should know that if you have carbohydrates, then your body will pay for it. I'm not saying don't have it. I'm saying you need to watch your diet. Avoid processed food. Avoid foods that are inflammatory. We've done many podcasts on it. You can listen to it. But one of the things we do, I don't know if you've heard this, when we talk to diabetics, right? We tell them after each meal, go walk for half hour. Why do you think? When you walk, you open up these receptors and they grab the sugar and they clear it out of your blood. So what I always tell my PCOS patients, after each meal, go walk for 10, 15 minutes. I'm not asking you to go to the gym. I'm saying go around your kitchen counter for 10 minutes. Do you know what I'm saying? But stay active. Let those receptors open up and clear that sugar out of your blood. And I want to make sure people don't confuse this. It's not about being thin. It's about being healthy. What's happening? Your weight is a reflection of your insulin resistance, right?
And your body's not working properly. And it's just about getting it back into, and everything will change.
And insulin resistant is causing your hair loss, causing your weight gain, causing probably these secondary moodiness. So it's all related. So when you're ready to have a baby, you feel better. Your confidence is better. You're ovulating regularly, because even PCOS patients who have regular periods have suboptimal ovulation. Those are the ones who still can't get pregnant, right? Because when you don't have a period, you're not ovulating regularly. As I drop your weight and, make you more insulin sensitive, your ovulations will become more and more and more regular. And as they become more regular, that's how patients get pregnant. That's how you pull a PCOS patient out of the hands of fertility doctors. Otherwise, someone like you at age 35 shows up to the fertility doctor, right? You don't have frozen eggs. You have insulin resistance that has, no one dealt with. So it puts you at a higher risk for having pregnancy complications like gestational diabetes, preeclampsia. There's a list of, things that can go on with being overweight or obese going into a pregnancy. So besides that, you have ovulatory issues. You're not ovulating regularly. So what do they offer you? They don't have time at that point to put you on metformin, drop your weight. What do they say? Let's do IVF. And then you have to write a check for $20,000 to have a baby. Where if you listen to me right now and we make you healthier, you will never need their services. Well, you'll need their services for egg freezing.
And I know that it worries her. It worries me, but she's had so many health issues. I'm just so verklempt about my baby getting this help. Because she's really had a hard time.
And the promise we both want from both of you is once you learn about PCOS and I help you treat your symptoms and you start feeling better, that you all talk about it. Because every woman who talks about it will bring awareness to this condition. It affects, 15% of women in this country. 75% of them never find out about it.
And it's why we started the podcast, is we want to give women who don't have the kind of access to Dr. A, all this information, whether it's breast cancer, genetic testing, menopause, all of this.
She knows that I cry at the drop of a hat. I'm not going to cry.
I know. Take a beat. Get a grip.
I wanted to cry, but she looked at me like, don't you dare cry.
Tess, thank you so much for coming and sitting down and being so open and vulnerable with your story. It's going to help a lot of women.
I know. We didn't even expect this.
I know. I feel
Otherwise,
so special.
We would have
we wouldn't have been on the spoon on this episode.
I love it. I love
And
it.
did you hear my Southern accent come out when I
I
get
know that Tennessee comes out. You go, thank you so much. Mhm. All right. Thank you for having me.
Thank you. She's a sweetheart.
She is. She's had a time.
So we just had this amazing PCOS episode with one of my best friends, Greg Renfro, whose daughter had PCOS, and it was just heartbreaking, her whole journey. So this is so, dear to our heart. And I know it is for you as a mom who, when your child is struggling with her health, you're only as happy as your most unhappy child. I mean, it just really is.
Yeah.
So thank you for letting us share.
Oh, thank y'all for telling us all this and I feel like I've always, tried to get people that thought outside the box that would, help her, but we haven't gotten all this information.
Yeah. It's
so I'm so thankful. Isn't it wonderful that there are podcasts and people that can, honest to goodness, I'm not trying to be sappy, but people really don't know what to do.
Yeah, that's why we did this. I met this one and I was like, if I can get her knowledge into every single home in America or the world, we'll change the world. And you have done that too. You made people laugh at the things that nobody thought you could even talk about. And I just want to thank you. And I love you so much, Leanne. And thank you so much for being on this
Thank you, angel from heaven. And I'm loving you in those boobs.
I love you.
I've had a ball. Thank y'all.
Thank you. Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.